Varicose veins are something that you may see or you may not. They may be underlying tissues. What happens is your heart pumps out fresh oxygenated blood down to your legs, and the way it returns is only through these veins. And it happens, I'll use my arms to demonstrate, but like if this were a vein here, when you squeeze your muscles, you're walking, moving, it pushes the blood up, the valves open and they close. All the way up you have these valves that open and close. So it's moving the blood gradually back to the heart. Well, what happens if these valves break? When you squeeze, blood goes up, but it falls back down. And that's what causes the swelling, particularly by the end of the day. Gravity's pulled all that blood down there and won't let it return to the heart because you have broken valves in your veins. Venous insufficiency, or as I call it, varicose veins, has a gradual onset. Patients may think it's just because of aging that they're getting these problems. But it's a progressive disease throughout their lifetime. They start with small spider veins, and eventually they'll see more bulging ones and get discoloration around the ankle. It can even lead to ulceration or worse. We can't say how fast it progresses, but it is a progressive disease. There are many causes for the venous insufficiency, or as we call them, varicose veins. A very common one is heredity. Also lifestyle. If you're just sitting at a desk and not moving your legs, well, the blood's going down there to your ankles and then coming back if you're not moving those calves. If you're standing on your feet all day and you're not really walking and moving, that blood's not coming back, it's pooling. Another risk factor is pregnancy. Remember, late in pregnancy, that your ankles are swelling, and what happens? The veins get bigger too. They're carrying that extra blood and the valves can break. We generally start a patient with a conservative treatment with compression stockings, and the compression stockings are gradient. In other words, they're specific measurements for the patients, the ankle, the calf, the knee. They have to be the right size for you, and they're stronger down here at the ankle, stronger pressure, and less as it goes up. Remember, we're trying to get the blood back to the heart, so we have it not just compression stockings, but gradient, where it's stronger down there, it's pushing it back to the heart. And very importantly, we do a thorough mapping ultrasound. And it's different than your typical ultrasound you would get at the hospital or in a clinic. This one is looking very detailed at the veins and taking specific measurements, seeing if there's backward flow or reflux. And it's done when the patient is at an incline or standing up. That way we actually see how the gravity's pulling the blood down and see if it's able to return normally or not.
We find the vein under ultrasound and we put a catheter into this vein. This catheter is very small, very, very thin, but it's very long, and we'll actually course it through the length of the vein. Most patients don't really feel that. They say it feels a little strange maybe, but it's not really uncomfortable. Once that's done, we put the local anesthetic around there to separate the vein from the tissues and to numb the vein and the local tissues around there. Once that's done, we'll actually turn the catheter on, and this will apply some heat that'll, in a sense, close the vein up. As we're pulling the catheter out, the patient should not feel this.
We want you to love your legs again. Vamos tus piernas otra vez.